And we are good to go, Stuart.
Okay, welcome everybody to Transformed Addictions rather in recovery. We have with Renaissance here today. So first I'm going to read the land acknowledgement and then I'll pass it back to Maria. We acknowledge the land we were meeting on is traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, Chippewa, and Haudenosaunee, and the Wendat peoples are now home to many diverse nations, including the Inuit and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. And back to you, Maria. Thank you.
Thanks, Stuart. And thank you everyone for being here, for joining us in the room or joining us online via Facebook Live. You can find this video on our Facebook page, the Gatehouse Child Abuse Investigation and Support Site. It's a really long name, but it's our legal one. I'm super excited to have fellow Marvel and Star Trek and Star Wars fans here with me. And not only that, they are also from Renascent Treatment Center. This is the Hope for Recovery 12-step based treatment at Renascent presentation by Alessandro Motta, who is a registered psychotherapist and program manager, and Erin Gilmour, who is also a registered psychotherapist and case manager from Renascent. And I'm going to pass it over to this wonderful duo to get us started today.
All right, awesome. Thank you so much, Maria. Thank you so much, Stuart. My name is Alessandro Motta, and I'm the manager of the Virtual Intensive Treatment Program for Renascent in Ontario. I'm here with my colleague, Erin Gilmour, today, and we're here just to share a little bit about our agency, our programs, and how we work with our clients who struggle with concurrent substance use and mental health issues. Thank you, Maria and Stuart, and to the Gatehouse for inviting us to this conference. I'm really grateful and excited to be here today to share with you my experience at working at Renascent with our clients. Admittedly, I'm really nervous. I'm anxious to be here today. I don't like speaking in front of crowds of people. So I'm just going to picture everyone in your underwear. And I'm pretty sure that's not a far stretch from the truth, from where we are, working remotely at our homes, on Zoom as well. So just a little quick thing about me. I joined Renascent in 2015. For the first 5 years, I worked as an intake counselor in the Client Care Access and Engagement Center, helping clients navigate the whole process of enrolling in our various treatment programs throughout the agency. And in 2020, I joined the virtual intensive treatment program team, which was a brand new program that we built out of need due to COVID. The last 2 years have been a tremendous learning experience for me and for the team that I've been working with. And we worked really hard to build a new and innovative program and steer through many challenges and opportunities with technology and other unique attributes to provide our clients the urgent care and support that they need. Today, I have the easy and fun job of just highlighting various things that are interesting about Renascent, about our programs and the team that I work with. Erin's going to go deeper into the meat and potatoes on our approaches and working with our clients through a trauma-informed lens and share on some of her experiences as well. One more thing that I am going to share too is that I'm an addict in long-term recovery. And I've also experienced many forms of trauma and have been a victim of abuse in my childhood. It may seem or sound kind of interesting and odd that I'm disclosing this, but it's something that's very, very unique about Renascent, as the entire clinical team has lived experience and they may choose to disclose where appropriate. Renascent really values the connection that self-disclosure can bring between a therapist and a client in therapeutic change. The approach encourages personal change, and disclosure can also reduce the impact of power imbalances as well. And that's a lot of the things that we found over my time, working at Renascent too. So for me, it's a very, very powerful therapeutic tool that I use, with the clients that I work with as well. So let me just share my screen here. Just bear with me for a moment because I think I forgot to do that. Hence, being nervous and full of anxiety. So when people ask what Renascent is and what we do, usually the boilerplate answer is that Renascent is a treatment center helping people achieve lifelong recovery with freedom from drug and alcohol addictions. And that's a great, standard, response. But what I like to tell people is that we plant seeds. We deliver a safe and structured environment for our clients to explore many of their presenting issues and find strength and courage to put the pieces of their lives back together through building resiliency. And most importantly, we provide hope. And many of our clients come to us hopeless and bankrupt, and emotionally, physically, mentally, and spiritually, in so many different, deep ditches they come from, seeking help and support. And, hope can be a really, really powerful tool as well. Renascent, we're one of the larger treatment centers in Ontario. We have 90 treatment beds. However, we have been severely impacted from COVID. When COVID first presented back in 2020, our capacity was reduced down to about 30 to 40 beds, while we kind of rebuilt layers and protocols to address safely delivering programming in our bedded communities. Now our capacity is up to about 75. So we're not back at full capacity yet because we still have a lot of layers and protocols there. We built a virtual intensive treatment program in response to COVID, and I'll go into that a little bit later on in the presentation after Erin's piece. And we're pretty large in terms of the call volume that gets handled. Throughout the province, we handle about 20,000 calls a year. People and their families looking for help and support. And it's pretty significant. And actually, we've seen a significant amount of growth, since that time as well. We're fully accredited. Our staff are educated, certified, accredited as well, and we're a nonprofit agency. And that, in itself is speaks volumes. So we help a lot of people. We're actually a hybrid model in our approach, to servicing the community. We do fundraising through our foundation. We have some funding that subsidizes many of our programs from the ministry, but we also do have some fee-for-service options as well, which goes to covering deficits and shortcomings in the subsidies that we receive, for some of our other programs. Okay, we're very values driven. So values drive everything that we do. There are guiding principles, as an agency and organization to keep us grounded, positive, and hopeful. And many of us coming from lived experience, it's very, very easy for us to practice a lot of these principles and recognize a lot of these values and incorporate these values in our day-to-day work activities and our engagements with our clients. We're very, very passionate about helping people and very compassionate as well. And we just lead by example, and that's part of our ability of giving hope to others. And so that's just a quick blurb about our values. So when we look at the COVID, the pandemic, the impact that it's had to people in general, we've seen a lot of that impact just because of the increase in our call volumes. We've actually noticed a 20% increase in our call volumes, but also in the media we've been noticing a lot more overdoses, a lot more complexities, and concurrent mental health issues, and a lot of that gets reflected as we do these intakes with the clients that are reaching out to us for support. We're finding more and more clients are presenting with more complex issues and have been more affected and impacted during this period of COVID. Originally what we intended to do was build some stopgap measures. Back in the day in 2020, we weren't quite sure how long this pandemic would last, and what the impact would be over the long period of time. And initially it was just meant to be some band-aid type solutions to give some temporary support and relief to protracted wait lists and increasing call volumes and other demands. And things have just grown phenomenally since that time, and we'll just go a little bit more into that when we're looking at our intensive treatment program. Since its launch date in 2020, we've serviced over 500 clients, which is pretty impressive in a short period of time. In the first year of this program operating, it was solely out of our own pockets through our fundraising initiatives, through generous donations that were received from some amazing people, to build this program. And the first year was 150 clients. And since that time up until today, we've serviced an additional 350 clients. In 2021, we've submitted some applications, to the ministry, and the ministry liked what we were doing with our programming, so they gave us some funding to effectively double our capacity and build out our program even more, which has been amazing. So we actually launched a second stream, an evening stream in February, and we're piloting a third stream, which I'll go into like a little bit more detail about as well. So it's just, really exciting. There are some major differences about our virtual program to our bedded program. So when we look at Renascent, let me just get rid of that notification there. Sorry. For 50 years, we've been in the business of, inpatient bedded communal type treatment programs. And we never even thought of doing, a virtual program. And when we first put together this model for the virtual program, the direction, the approach that we wanted to take was to emulate as much as possible what we're doing at the houses into this virtual delivery mechanism. And there was a lot of, piloting, a lot of, experimenting, trying different things to see kind of, what worked. But I think over a course of several months, we were able to really get the essence and, the core components of what we were doing at the houses and put it into a virtual framework and deliver that to our clients in a safe and effective manner too. And that was another key consideration too, is that, we wanted to make sure that the community that we're building over this virtual technology was a safe community, that there was a high level of efficacy, positive outcomes, from the treatment experiences that our clients were going through as well. There are some major differences though between our virtual program and the inpatient program. One of the biggest things is that there's no medical directors involved with the virtual program. So at our inpatient bedded programs, we have 2 medical directors that are responsible for the client communities. In this program, the clients need to have their own addiction medicine doctors or get connected to a RAM clinic or other types of medical supports and be stabilized to attend and participate in our program. Our program is co-ed, the virtual program, compared to the treatment communities at the houses. They're all gender specific. So this is something new and different for us as well in terms of our our approach and the way that we look at how we work with our clients as well. And even the determinants of needs are a little bit different to the clients that are currently accessing the virtual program compared to the clients accessing the programs at the houses. The needs are somewhat different, and Erin may touch on that, or I may touch on that a little bit later as well. But for the most part, this program is pretty much identical to what we deliver and provide at the houses. So what I'm going to do now is I'm just going to give Erin remote control access, and I'm just going to hand over the presentation to Erin, and she's just going to go a little bit into more detail and introduce herself. So Erin, it's all yours.
Thank you so much, Alex, and thank you for that amazing explanation of what Renascent does and how we're connected to the community. Can everybody hear me okay? Yeah, okay, cool. So my name is Erin Gilmour. I am a registered psychotherapist and a registered social service worker in the Renascent Virtual Outpatient Treatment Program. I am currently working to build and implement the new case management program within the virtual program. And I've been with Renascent off and on for about 8 years now. I started my career in the inpatient Graham Monroe Center working with women in the bedded program as a student, and then eventually moved up towards primary care clinician. And I have since returned to the virtual program, working in a capacity first as a primary clinician primary care clinician, and then now working in the case management program. And my experience with Renascent has shown me firsthand and so deeply the connection between trauma and between addictions. Some of what I'm going to say here is statistical, and you'll see that later. It's proven with studies, and some of it's going to be anecdotal from my experience. And this piece is anecdotal. But the majority, like definitely more than half of the clients that I've worked with in the addictions field have identified trauma as a primary concern for them and have directly related their substance use to the impact of the trauma that they've experienced. So there's a high correlation between addictions and disclosure of trauma. So what we're going to do now is talk about some of the ways that trauma presents in the treatment process. So what it might actually look like while a client is in treatment for their addictions, how trauma shows up, how it may impact the process. And with this, there's challenges and there's also successes, because one of the ways we can look at trauma is, post-traumatic growth and an opportunity to learn and to grow and to change from that difficult situation. And I see that all the time with our clients who are able to change and grow and heal. So we're going to also be talking about healing. And there we go. Okay, so just to frame the discussion of trauma a little bit, there's lots of ways of looking at it. One of the things that we're going to be talking about today and relating back to is this concept of adverse childhood experiences, which is a questionnaire, a scoring table, so to speak, where people rate themselves on how many adverse childhood experiences that they've had. And we've seen that the higher the number of adverse childhood experiences, the higher the risk of traumatic symptoms, the higher the risk of diseases such as mental health issues, addictions, even physical diseases like heart disease, obesity, diabetes, etc. They all correlate with the higher number of adverse childhood experiences. So just broadly speaking, ACEs or ACEs, as I might refer to them, are stressful or traumatic events. This includes abuse and neglect. ACEs might also include witnessing household dysfunction, domestic violence, growing up with a family member who has substance use disorder. And that's an important piece that we're going to be touching on later on in the presentation in regards to preventing trauma and how Renascent works towards that. So ACEs are strongly related to the development and prevalence of a wide range of health problems. Like I said, specifically, we're looking at addictions today. So the link between trauma and addiction, here are some statistics. I'm just going to move, just give me a second while I move the faces on the screen here because they're blocking my view. So according to a study on childhood abuse, neglect, and household dysfunction and the risk of illicit drug use, each ACE, so every time somebody identified with an adverse childhood experience, it would increase the likelihood of early initiation into illicit drug use by 2 to 4-fold. So those are significant numbers. Compared with people with 0 ACEs, people with a score of 5 or greater than 5 were actually 7 to 10-fold more likely to report illicit drug use problems and addiction to illicit drugs. Studies indicate that among the population of individuals seeking treatment for substance use and alcohol use disorders, so these are the clients that we work with, those seeking treatment, 42 to 95% of men and 50 to 99% of women have experienced trauma. So working, as I said, as a primary care clinician directly with clients seeking addictions treatment, I can vouch for these numbers. The vast majority of our clients self-report trauma. And we're talking a little bit about early childhood experiences and that correlation with trauma. But I also want to say that trauma exists and happens as a result of addiction as well. And trauma exists and happens later on in life. And that can also correlate with addictions as well. So Renascent really recognizes the importance of trauma-informed care. We are a trauma-informed facility, and we work very hard to make sure that our staff are working under a trauma-informed umbrella to make sure it's a safe and stable place for our clients. And we'll talk about some of the ways that we do that, but it's very apparent working in the addictions field how necessary it is to use a trauma-informed lens. We are not a trauma treatment center, though. I feel that just came to my head. I feel I should say and clarify. We're not a trauma treatment center. We don't specifically do trauma work. We are trauma informed, which is we maintain safe and stable place for clients to work on their addictions treatment, maybe identify and validate their trauma, but not specifically go into it. So some of the ways that trauma, so clients who are presenting with trauma or have a history of trauma, may show up in our treatment process. Some of the ways that their treatment may be impacted by having trauma are listed here. So I'll just speak a little bit to them. So clients have a strong need to self-medicate, and substance use is an important coping skill for those experiencing mental health issues or trauma often. So if we think about symptoms of trauma, we can think about flashbacks, extreme anxiety, being in a constant state of activation. The list goes on, physical pain, emotional, mental pain. That can be extremely uncomfortable to live with. It can be impossible to live with sober. So many of our clients use substances to actually feel normal and to self-medicate these feelings so that they are capable of functioning in society, going through their day, meeting the expectations of society, going to work, taking care of their families. Many clients feel that they're actually not able to do that without some sort of self-medication. And so that's one of the barriers we see with our clients, is they really feel they need these substances that they've become addicted to and have become problematic for them. So numbing these trauma symptoms is often a very effective way to continue to function. As I said, this type of drug use, alcohol use, is not for fun or to feel good. It's a survival coping skill. And we as clinicians really need to recognize that. And I think as society, we need to recognize that, because we're so quick to judge a substance user as being weak or morally defective. And in reality, they're just doing the best they can to get through the day. So it's a struggle for these clients to remain abstinent as well. Because when they put down the drugs and alcohol, sometimes there can be a resurgence of these trauma symptoms. So at Renascent, at treatment centers, our goal is to assist these clients in learning, practicing, and effectively utilizing safer coping skills as a replacement for the substance use. So we don't want to just take away the substance use and leave them to their own devices. We work really hard to assist our clients in implementing safer coping skills to deal with their trauma symptoms. We also pay attention for other replacements with other unsafe coping skills. So the staff are always on observing and assessing for the replacement with other unsafe coping skills like self-harm or risky behavior, and working with our clients to ensure that they have a safety plan and are using safe coping skills. A lot of our program is on skill building, based on skill building. Difficulty engaging in program can also show up. So trauma symptoms can impact the client's ability to remain present and engaged in program. So think about, all those symptoms that I described earlier, how difficult it would be to sit still and absorb information from a psychoeducational session, for instance. We also see clients with trauma presentations missing sessions. So lots of time missed, having difficulty remaining on topic or returning back to a trauma narrative if it maybe isn't the time or the place to do that in group, for instance. These clients sometimes struggle to stay focused during treatment planning sessions, and they're activated frequently. And as we know, when somebody's activated, their prefrontal cortex, the part that does the planning and the intellectual understanding of things that we need to talk about in recovery, is kind of offline. So we have to find a way to get it back online. Some of the ways that we can do that with a client who's in a constant state of fight or flight is to really focus on that stage 1 safety and stabilization, and making sure we create a safe place, because then that prefrontal cortex can come back online, and we can do some treatment planning and goal setting. So in cases like this, we meet the client where they're at and tailor treatment strategies to their needs while maintaining our program structure. We might focus on goals of harm reduction, accessing needed services, and learning grounding skills. Again, we always take a trauma-informed approach, which means that we're client-centered. And if something isn't working for a particular client, we modify our approach to ensure that we are meeting their needs the best that we can. And one of the ways that we can also do this is referral out to safe and trusted supports. So I spoke a bit about how we work with trauma. This is just an overview. So we are stage 1. We do safety and stabilization work. That is one of the core tenets of trauma-informed practice. Our staff do this in a variety of different ways. We've all received training. I know some staff favorites are, safe place meditation, grounding skills, utilizing the 5 senses to remain mindful and present. We focus on creating safe spaces in our inpatient treatment centers, and it's been quite a journey figuring out how to do that online, but I think that we've been pretty successful doing that as well. We work with clients to make sure that they're in a safe space as much as possible. Again, we do coping skills practice. We implement seeking safety materials. Our program incorporates emotional regulation skills. Renascent is an abstinence-based treatment center, so we provide abstinence support. We do personalized treatment plannings with our clients. The staff undergo regular trainings, and we do have a case management program that ensures safe and effective referral to supports and warm referral when possible. Another really cool thing about Renascent is we work under the 12-step model. So as Alex mentioned, all of the staff have lived experience with recovery. That includes me. I'm active in 12-step program, sober, been through the addictions piece, and now thriving in recovery. And we get to share that with our clients with the 12-step model. So Renascent is 12-step based. The counselors are 12-step based as well. However, we implement, we're an eclectic modality of very different, or a bunch of different evidence-based therapies. 12-step model is one of them. So the reason why the 12-step model is very cool and effective is that it's actually a holistic approach to recovery, which encompasses behavior change support, spiritual development, peer support, and community connection, which is a very important piece for our clients. A 12-step group is free. It's always accessible. It can work as an adjunct to regular treatment. So we encourage all our clients to go to 12-step meetings. Also, it's fantastic aftercare support and can exist for as long as the client wants to go, those meetings will be there. So it's a really fantastic support. The 12 steps align well with many evidence-based practices such as CBT, motivational enhancement therapy, and ACT, so acceptance and commitment therapy. These are just some principles, so they're not the steps themselves. If you're not familiar with them, this isn't the actual 12 steps, but these are some of the principles that are incorporated into the steps, and we weave these into our program as well. So we have ideas like honesty, hope, faith, integrity, willingness. So just an overview. So what does healing look like in recovery? It looks different for every person. Our clients all set their own goals for themselves, and we work hard to help those clients meet those goals. But some of the impacts of successfully completing our program and clients meeting their goals are listed here. We have reunification with families, ongoing healing work, changed and reevaluated life priorities and values. I'm going to do a time check here. An increased sense of preparedness and capability. So again, this is going to be different with every client, but it's so rewarding to see our clients complete the program and tell us that they're doing really well in all these areas of their lives. And this wasn't a part of what I wrote down to say, but I'll just share it. Renascent has a really amazing alumni program. And so our clients can actually stay engaged with Renascent and share what it was like for them and the successes they're having. And we also have an aftercare program. So cool to see our clients heal and recover and seek additional treatment for trauma if that's what's come up for them. So we're just going to do a case study to talk about practically how we would work with a client who presents with complex trauma or any trauma. This particular client, who we will call client D, initially did his intake to come into the virtual intensive treatment program. And at the Access Center, which is where the intakes and assessments are done prior to entering treatment, he did disclose that he had experience with trauma. He didn't feel comfortable to share what that trauma was or go into detail. And he actually mentioned in a couple different places in his intake and assessment that he felt very nervous and very scared to be a part of a group session online, a group session at all. and presented to our program as willing, but also very hesitant and closed off. As he continued to attend our program, so some of the things he presented with was, so an addiction, he had difficulty coping with daily challenges, anxiety, depression, flashbacks, and difficulty participating in relationships. So this is somebody who self-identified as agoraphobic and was actually referred to our treatment center because he was missing a lot of work and then missing all of work as a result of this fear of leaving his house. So he participated in our program, and as time went on, he began to feel safe enough to disclose some of what was going on for him. And that is one of the successes of the Renascent program, is that we do create that safe space. And I think that's proof that he, that he felt safe enough to start talking about this. And when he did, it was disclosed a history of severe complex trauma of various types from infancy, truly throughout life, including a significant amount of grief. Renascent, being a trauma-informed treatment center, recognized some of the challenges this person was having opening up and engaging in group and feeling safe were probably related to his experience with trauma, as well as the presenting issues that he had. So addiction, definitely the anxiety, the flashbacks, we recognize this is probably related to trauma. We supported the client in validating the trauma that he had experienced. This is a person who had not accessed this type of service before in terms of their mental health. And so in creating that safe space, he did a lot of work with us. Some of the ways that we worked with him. So the first thing before we even knew what we were doing is we reduced barriers to accessing treatment because we offered a virtual program. This is a person that, because of their trauma presentation, probably would not have ended up in a bedded inpatient treatment center. It would have been too anxiety provoking and too scary. So he was able to access treatment because our program is virtual. When we recognized what was happening for this client and some of the barriers that presented for him, we assigned him a primary care clinician. Previous to that, all of Renascent's primary care clinicians were, it was a shared caseload. So a client might meet with different counselor each week. This client got to meet with the same counselor every week to continue building on that safety and stabilization. And as he did that, he opened up, shared. This person has grown so much, such a success, self-reported success. We also incorporated case management and referral to community supports for this client. So we ensured that there would be a continuum of care and that after he finished our program, he wouldn't be left without supports. And this client was able to work with our spiritual care worker. He's a counselor that we have with us who does spiritual care and grief work. And this client had special sessions with this person to continue working towards grief healing. So some of the outcomes, this client successfully completed treatment, which sometimes we don't see if people have severe presentations of trauma symptoms. There can be a dropout rate involved in that. This client successfully completed treatment. He had a self-reported improvement in mood and outlook. He was able to maintain abstinence and reported no desire to use his substance of choice or any substance again. And this was while in treatment. And this person has continued to engage with Renascent and reports that he's doing very well. So this is an example of how trauma might present and how Renascent tailors its approach to deal with trauma. How am I doing for time? Okay, so working to break the cycle, abstinence and harm reduction is an approach that Renascent takes, and we can see that as a strategy to reduce the risk of further trauma. Addictions is a higher risk disease. It just inherently can lead to risky situations and further traumatization. So by supporting our clients in achieving recovery, we reduce that risk of further traumatization in those situations. We support recovery as a strategy to prevent trauma for families and children. So if we think back to children being in an addictive household can cause adverse childhood experiences. If we can support the parents in becoming abstinent in recovery, we can mitigate some of that risk. We provide linkage to trauma treatment supports. And we have a children's and family program that supports family members experiencing challenges as a result of addiction. So if we have a client enter into our program, their family members are also able to access a children's program if it's a child, and a family counseling program if it's an adult. Okay, and now I will pass it back over to Alex. I kept wanting to ask, are there any questions throughout that process, but we have time for that at the end. So Alex, take it away. You're muted.
How many times have we been saying you're on mute for like the last 2 years? And we can't still, do it right, but it's okay. It's all good. Erin, thank you so much for that amazing presentation and that case study as well. It's actually kind of interesting that clients, when they meet with our Access Center to do their initial intake screenings and assessments, many of them do not disclose, their history of trauma. And it isn't until that they're engaging in programming that they are, part of an environment that's, safe to them, building, a really good, healthy relationship with the support team that they're working with, that they're able to start, sharing a little bit more openly about what's, going on. And we find that a lot of the clients that we're working with as well have, a lot of their history of trauma hasn't been addressed or resolved, right? So for many of them, it's a first time experience. And actually, I even relate to that piece myself. I haven't, looked at my history of trauma until I was a couple of years into my recovery, right? So for these clients, being able to, look at these presenting issues sooner than later, it really does give them, a bit more of a jump start on building a pathway to healing and recovery for themselves as well. And it's really, really important, when we build this safe environment for them. So fantastic work. Thank you. So what I'm going to do is I'm just going to dig a little bit deeper into this virtual program that's been built over the time. It is a 6-week intensive treatment program. It operates about 3 hours a day on weekdays. So it's a Monday to Friday. And how these weekdays work, it's 2 group sessions. There's a process check-in group and a psychoeducational group, education group for the clients. Upon completion of this 6-week intensive program, clients are referred to and are allowed to participate in a 6-month continuing aftercare program. And that's also covered through this ministry funding that we received. So the ministry funding covers the 6 weeks of intensive treatment plus the 6 months of continuing aftercare for the clients. Currently, it's once a week, and it's 3-hour groups for the aftercare. But we're actually building that out a little bit more, and it'll end up being a couple of days a week, for the aftercare. And there's going to be some improvements to that. We are very, very family focused and oriented in our treatment with our clients. So we do have family programs as well. There's a family programming for adult members of the family, and there's a children's program that's available, to our clients and their families. And we're very eclectic in our approaches, working with our clients. When I look at the team of people on the virtual team, it's a wide spectrum. We have social workers, psychotherapists, we have people who have Masters of Divinity and, other training and education and experience. And each person has their own unique combination of approaches that they like to use with clients, and many of them are evidence-based, many of them are more counseling style approach as well. And it's just amazing just to see how all of this seems to work well with the client community, because it does give a lot of different options for the clients. Some things work better for some clients than others, right? And it's been pretty successful. And we all have a lot of ongoing training too, so we are learning continually, to grow our skills, learn different approaches, different practices and methods and tools that we can use, to apply it in this environment. And, I would say like the last 2 years of building this program has been an ongoing experiment. And I think it's still going to be an ongoing experiment as we continue to learn to, harness the potential of, this technology. as well, and it's pretty it's pretty substantial. And I just want to like reiterate too that when this program was originally developed, it was just meant to be a temporary stopgap solution, and it's just grown in leaps and bounds. Never have we imagined that it would take a hold and go in the direction that it went. And just really, really grateful for like a lot of the stakeholders in the agency and a lot of the people in the community that really saw like a benefit for this program and really encouraged us to keep moving forward and continue to build it out and make this more accessible. When it started as one stream, it grew into 2 streams, and now we're piloting a 3rd stream because now we're having discussions and conversations about breaking down barriers to access to this program. Traditionally and typically, clients who are able to access this program have access to technology, maybe in a stable environment that might be safe for them, right? So like all of those check boxes are there, but there's a lot of people who don't meet those criteria who cannot benefit from this program. So one of the things that we're piloting in a 3rd stream that we're building is we're looking at integration opportunities with partner hub agencies. And right now we're doing a pilot project with an Indigenous Friendship Center in Ontario. And they've referred a number of clients to us, 9 clients, and we're doing a specialized aligned treatment program. It's a cohort model. Our other streams are continuous enrollment. This is cohort, so all the clients start on day 1 and finish on day 30 together. And we're going to be learning more about that as well. But I think the potential and the benefit here is that now we can provide access to marginalized communities, clients who may not have access to technologies or be like in a stable environment to participate in programming. They can go and access our programming through a community hub agency as well that can give them access to that technology, that can give them that stable environment as well. So that's one of the directions that we're looking to really like improve and develop this program, because there's a lot of potential that hasn't been recognized yet, and we can go in so many amazing directions, and that's something that I'm really, really excited about and looking forward to moving forward. We do apply a lot of evidence-based elements in our programming. We look more at the skills from a lot of the EBTs, because when we look at the 6 weeks, it is a very, very brief period. So it's really hard to do like, any long-term EBT based, therapeutic approaches with our clients. But, in the first 6 weeks, clients get presented with and exposed to different types of therapeutic approaches, and then can quickly find and discover what starts working better for them, and that could be like a direction and a trajectory that they can move forward on. And we can actually start looking at referring clients to other specific longer term programs that are more EBT focused and aligned, right? And it's just it's kind of cool how it works. It's without sticking to one modality, one approach. We have some flexibility, and we can actually serve a larger community, community that is very variable in many, many cases. And, we've learned to become really adaptable and malleable as a result as well. And it seems to be working well. I don't know how or why, but it does. And it's like, just pretty amazing. And Erin also touched on it as well. After the continuing care, there's alumni care. And, when we built the virtual alumni care program, it's just amazing to see like today that program is being attended by clients who participated in this virtual program 2 years ago. And so they're just, carrying on that message of hope, to the client community that are just, starting to go through this program, that are just recently completing this program, maybe starting to get into aftercare, and, being a part of this community that's, working together to support each other is just, phenomenal. It actually even goes further towards helping clients, build resiliency and finding strength, to continue on maintenance, with respect to their abstinence. When we look at how we fit as a program, it's kind of interesting, so I wouldn't say that this virtual intensive treatment program lines up very linearly to an IOP, necessarily like an in-person IOP. I think, we have the capability to straddle multiple tiers in the model. And we have had work with clients at higher and lower level of needs, when we look at, placement. And it's just been kind of interesting too. And the really cool thing that, this virtual program has given Renascent as an organization is the ability to step up and step down the level of care for a client. So we've actually had clients at our inpatient program come to our program if they needed some more support, and even vice versa, that the virtual environment may not be the best supportive environment for our clients. We can advocate and have that client transition to one of our inpatient programs as well. So it actually gives more flexibility and adaptability from like an agency-wide perspective when we're looking to serve our clients, and that's been pretty amazing just to see how that works together. And that was like a gap that we've had for, I guess, 50 years, right? It's something that we just recently introduced a couple of years ago. When we look at evidence as well, we're evidence informed too. So we rely a lot on client feedback, but we also partnered with a third-party organization, Ontario Shores. They are doing a fidelity assessment and a program evaluation. So this is part of our funding agreement with the ministry as well. The fidelity assessment is almost at a completion right now, and they're going through the program evaluation piece. And there's 3 surveys involved with that. So there's a survey that's done at admission, a survey done at 6 weeks completion, and a survey done at 6 months. And it's just to measure, certain types of outcomes. And a lot of that's going to be presented back to us so we can look at ways that we can further improve and grow and develop this program. We also have our own virtual care surveys that we have the client community fill out to give us, feedback as well. It's actually based on the CAMH virtual care survey tool. And we're looking at implementing the Ontario Perception of Care approach as well. So a lot of treatment centers that are funded by the ministry use this OPOC tool. And internally, we do follow-up calls with the clients at 1 month, 3 months, and 6 months after they finish our 6-week program to see where they're at, and just to get some more feedback. And we actually, at the 6-month mark, we invite clients to come back as an alumni contact to be basically a peer support, to someone who's just recently completing or engaging in one of our programs as well. And that's how we do peer support, is we actually use our client community to participate and be part of that. And so that's also very much aligned with the 12-step model too, that the 12-step is giving it away to other people in recovery and supporting each other. So it's been pretty amazing to see that. How clients access our programs, it all starts in the Access Center. So we have a centralized Access Center. It's an amazing team, phenomenal work. I've worked there for 5 years. It's just incredible the amount of work that they do, helping all these clients navigate through accessing the various treatment programs within our agency. We use a lot of best practices and good practices and tools to do our determination of readiness and suitability for participation in any of our programs. We are a concurrent, capable treatment facility. So we do work with clients with substance use and concurrent mental health issues. Our sweet spot would be moderate to severe substance use and mild to moderate mental health concurrent. Or we can look at severe concurrent mental health if they're stabilized on medications and under psychiatric supervision. So that's basically the area, the grouping of clientele, or the sweet spot that we work within. And we use all these tools to help measure that and to determine that suitability. And it's a pretty extensive process. So the Access Center, they do like an intake with the client, schedule an assessment, go through all of these tools. And then once all of that is done, they're assigned, their admission date into our program. So the client experience starts with the Access Center. The referrals are self-referral basis. So clients can just reach out to the Access Center themselves by calling the toll-free number, which is at that bottom of that slide. But we do have some partnerships with some agencies out there where we do have some work transfers and referrals from these agencies. And it's a really rigorous process that we go through with the clients, but we just want to make sure that we're able to provide the best level of care that we can, and that we have a really good, clear understanding and idea of where they're at, so we can help them put together their treatment plan and put together their care plan as well. With that, that's the last slide. So I think we're done. Maria, Stewart, thank you so much for giving us space to share about our programs and our experiences. This is our contact information if you have any questions to send Erin or myself. I think we were supposed to leave 10 minutes at the end, which we're at 3:21. So I'm sorry for taking away a minute from everyone, but if there's any questions for us to answer, and if not, great, everyone gets back 10 minutes of their time. I'll hand it back to you, Maria or Stewart.
We're back. Thank you. That was very, very informative. And I really like what you guys do in regards to addiction. I think people, when it comes right down to it, and again, speaking from experience, my own addictions, I relied on AA to help me and NA to help me to get through my process. And the biggest thing I never realized through my whole to where I am now is prior to me getting help from the Gatehouse, my addictions were, and I like how Erin emphasized or talked about this earlier, is my addictions were my coping strategies to get me to where I am today. And it's a shame that people look at addictions as being, whether it be disease or it's horrible, and don't realize that, well, they had to get it someplace, some kind of trauma. They don't see the little bits and pieces that are involved in that. And I know that when in my own recovery, even today, I mean, I'm always healing and moving forward, but I have to look back at how I coped. And the addictions was my big thing, never mind the other nasty things I did to myself. But I wouldn't be here today if it wasn't for that, when I think about it. So in a sense, yeah, it was wrong. People can judge me as they please, but it's literally saved my ass to get me to where I am here today. And today I'll ever be so grateful for that. And thank God for the 12-step programs they have out there, because it helped me realize a lot of other things that was going on in my head at the same time, to why I was using and wouldn't rather, even talking about using. I know that when I was helping myself at the house, I struggled back and forth until I finally stopped it completely. So it's been many years now that I haven't used, but man, oh man, what a journey it has been. And I think that once people try to do this and look at themselves, and even with their addictions, that healing is possible. So thank you ever so much for being here today.
Thank you so much, Stuart. Thank you.
Okay.
Thank you.
Now, is there any questions in the chat? Maria, did you see any?
I don't think so. I did have a question, but Alessandro did answer it in terms of the referrals, right? It's one of the questions that we get often at the Gatehouse is, how do people access the program? And it sounds like they can do self-referral there for Renascent, which is great. And it's so wonderful to have virtual resources available, as we're still mostly virtual in our location. For sure at the Gatehouse, we're still all virtual for the adult support side of things. If there are no comments or questions, I want to thank Erin and Alessandro on behalf of the Gatehouse, and thank you to the team at Renascent. Special shout out to Mark over there as well, for doing all that you do to help people in recovery from addictions. You will never know how many people you're actually impacting, because for every one person, there's at least 4 more that interact with them, if not more than that. You're impacting those people as well. Thank you for being who you are and showing up for everyone in society as you do. Have a safe and wonderful rest of the day, everyone. We're going to come back at 4 o'clock with Kelsey LaRue, and she's going to be talking about creating safety for survivors from a BIPOC perspective. Thanks, everyone. We'll see you soon.
Thank you so much.
Thank you.